What are the next steps after an abnormal liver ultrasound? Getting an abnormal liver ultrasound can feel confusing, but it's an important step in understanding your liver health. It doesn't mean you have a diagnosis yet, but it signals that further testing is needed to find out what's going on. Your next move involves working closely with your healthcare provider to clarify the findings and plan the right course of action. First, your doctor will review the ultrasound report with you. They will look at what the imaging showed, such as an enlarged or shrunken liver, irregular surfaces that might suggest scarring or tumors, fluid buildup, or abnormal blood vessels or bile ducts. This discussion helps your doctor connect these findings with your symptoms and medical history. It's a crucial step to decide what tests are needed next. Most often, additional blood tests are ordered. These tests measure liver enzymes, proteins, and other markers to assess how well your liver is functioning. They can help identify conditions like hepatitis infections, fatty liver disease, or signs of liver damage. Blood tests can also screen for viral infections or autoimmune issues that might be affecting your liver. If the ultrasound results aren't clear enough, your doctor might recommend more detailed imaging. A computed tomography scan uses X-rays to produce cross-sectional images of your liver, revealing damage, masses, or blood flow issues. Magnetic resonance imaging uses magnetic fields and radio waves to create highly detailed pictures, especially useful for distinguishing benign from malignant tumors or detecting fatty liver. Sometimes, contrast-enhanced ultrasound is used, where a special dye helps visualize blood flow in the liver, providing more detail. Another helpful test is elastography, which measures liver stiffness without needing a biopsy. This technique can tell your doctor if there is significant scarring or fibrosis, which is common in chronic liver diseases. It is non-invasive and can be done alongside ultrasound or MRI. The most definitive test is a liver biopsy. This involves taking a small tissue sample with a thin needle, guided by ultrasound or CORT. The tissue is examined under a microscope to look for inflammation, scarring, fatty deposits, or cancer cells. While it is more invasive, a biopsy provides detailed information that can confirm a diagnosis and guide treatment, especially if there is concern about liver cancer. Depending on what the tests reveal, your doctor may suggest monitoring your liver over time instead of immediate treatment. Regular follow-up ultrasounds or other imaging help track any changes. The frequency of these scans depends on your specific condition and risk factors. For example, people with cirrhosis or a history of liver cancer need closer surveillance to catch problems early. Once your healthcare team understands what's causing the abnormal ultrasound, they will develop a personalized treatment plan. Management varies based on the diagnosis. For fatty liver disease, lifestyle changes like weight loss, healthy eating, and exercise are often recommended. If viral hepatitis is involved, antiviral medications might be prescribed. For cirrhosis, treatment focuses on preventing complications, which can include medications, dietary adjustments, and regular monitoring. If liver cancer is suspected or diagnosed, options may include surgery, ablation, or other targeted therapies, depending on the stage and your overall health. Your doctor might also refer you to a liver specialist or gastroenterologist for further evaluation and management. These experts can interpret complex imaging findings, perform advanced procedures, and help you understand your condition better. In summary, an abnormal liver ultrasound is a starting point for a detailed investigation. Expect your healthcare provider to order blood tests and possibly more advanced imaging. Stay engaged, ask questions, and keep copies of your reports. Early detection and proper follow-up are key to managing liver health effectively. Remember, every case is unique, so personalized medical advice from your healthcare team is essential to ensure the best outcome for your liver.